Well, welcome to the Ask Dr. Wilson show. We are your hosts. I'm Dr. Nick Wilson.
I'm Dr. Tracy Gross. On this podcast, we have conversations about health. We talk about what it is, where it comes from, and really how you can achieve it for yourself and your entire family.
I hope you enjoyed this episode on the Ask Dr. Wilson show. Okay, so today we're talking about kids and chiropractic. Why do kids need to be adjusted, and do they really need to be adjusted? That's the question that we get often.
Yeah, patients come in all the time and they ask, well, my kid doesn't have any pain or they don't have any issues. Why in the world should I get them adjusted?
And it's a valid question because when you think about chiropractic, most of the time people will think of neck pain, back pain, headaches, sciatica, numbness and tingling, shoulder problems, things like that. Mm-hmm. And it's usually palliative or relief. And, you know, a lot of people, that's what drives them into a chiropractor. And that's what drives them into our clinic oftentimes is that there's some type of ache or pain or problem. Right. And usually kids don't have those aches, pains, and problems.
Yeah.
And so the question is, why do they need it then?
Yeah, I think that a lot of people are taught when it comes to their health to be reactive about it. So we wait until a problem comes up when you can really take the more proactive approach and check kids. A lot of the adults that we see in our clinic, they have problems that started back when they were kids. Mm-hmm. These are issues that happened from any number of things, from playing on the playground, from injuries, from sports, from even a traumatic birth. We have adults that come in and they had traumatic births as babies, and that caused damage in their spine and their nervous system that didn't show up as symptomatology until they were well into adulthood. Mm-hmm. So really, getting kids checked it's just the right thing to do because it can prevent them from ever having to go down the road of sickness and disease. And really, it increases their life potential. Because when you think about people who are sick and they're suffering and they're in pain, are they really living their life to the fullest?
No, they're not.
Think about all of the things that they could have done or could have been had they not had to deal with pain. And if we can set up kids from the very beginning to never have to go down that road, then you are giving your child the best chance at living to their greatest.
Mm-hmm. I think about how many times you and I have conversations with a person, 55 years old, and we're looking at that person's spine. We had this it was probably 2 weeks ago. I remember it was a later night on a Wednesday, and I'm meeting with this person, and it's him and his wife, and I'm going through the x-rays, and it's very clear that the problems that I'm seeing on these x-rays had to be decades ago, like literally probably 40 years ago. And we can see that because of the amount of degeneration or arthritis that had built up there. And he was asking questions like, where did this come from? How did this get here? And I can't just look at an x-ray and it's not a crystal 8 ball.
Right.
You know, I can't see, well, you definitely had an accident when you were 15 or something like that. However, the length of time the problem exists there does actually show up on the x-ray. The amount of arthritis that exists does show up on the x-ray. So very much like when you cut a tree open, you can see the rings and they can kind of date how old the tree is. Well, the same thing with the spine. When the spine has been degenerated for such a long time, there's been a problem. It's not just an old age thing. It's that the problem has existed for a while and it's not been corrected. Very much like alignment on your car. We talk about this quite a bit. When the alignment on the car is off, the tires will bald unevenly. And the more balding that is there, the more time that car's been out of alignment. Okay. Mm-hmm. As he was thinking through like when his problem might have started, he's like, oh man, do you know what? I fell out of like a second story of the barn when I was around 14, 15 years old. He's like, literally, I fell out of the top story of the barn. He said, and I landed like on the back of my head and neck, kind of like rounded out. And he's like pointing up here. And that's exactly where his problem was. And he said, do you think that could have caused it? We're seeing phase 2 degeneration, actually phase 3 in 2 places. And I don't know for sure on the answer. to something like that. But I know for sure this, when you have an incident or accident or injury or something like that, and it's not properly taken care of, it's inevitable that that problem is only going to worsen over time. And you don't always feel that worsening. Like he didn't feel that growing up, like, oh man, I've got this problem that exists here. He's just never been checked. He never had a corrective chiropractor along the way who stopped him and said, listen, this is why it's important, not just because of spinal alignment, but the nerves. The nerves go to every organ, cell, and tissue. And so when you compromise the spine, you actually compromise the nerves too. And whether that's a sensory nerve or not is irrelevant. What I mean by that is whether you feel that or not is irrelevant. You don't always feel it. And it's not just the falling out of the second story of a barn or the football injuries or, the big ones that we think of as far as, car accidents. It's the little things over time. Think about your children. If you have children, think about how they are sitting in their car seat. I don't know if you've ever seen this. It drives me nuts when I see children in car seats and their neck are just flopped over all the way to one side.
Oh yeah.
Do you know what I mean by that? And then we wonder, why does this child breastfeed off of one side more than the other? Why does this child it crawls with one arm more than the other or one leg? And some people take videos of this and they're like, it's cute. See, she only uses that one left leg there. And she just figured out, no, it's not cute. There's usually an underlying problem there that's going to manifest itself in bigger problems if it's not corrected.
Yeah. Yeah. So at the very heart of all of this, chiropractic care is for the strength and the integrity of the nervous system. We can talk about symptoms all day long. We can talk about biomechanics and misalignment, but what it comes down to is the nervous system. I do want to bring up a couple of symptoms because I know that there's a mom out there who is listening and will resonate with something that their child is dealing with. And I want people to know that there is hope. Yes, chiropractic does help with symptom alleviation, but it's with an understanding that it's strengthening the nervous system. And the symptom alleviation is a result of that.
Yeah. And shout out to the dads there too. I know you're listening and you're paying attention to not just the moms. Come on.
Yes. Okay. We can't leave out the dads. But misalignment in the spine, damage to the nervous system will sometimes show up in kids as symptoms such as colic, babies who are really colicky. Torticollis, that's another common one where there is spasming of the muscles in the neck, and so the head turns to one side or the other. Also, when babies have difficulty nursing on both sides, babies should be able to equally nurse right breast and left breast. So if they can't, then there could be an issue with the TMJ, could be an issue with atlas, the very top bone in the neck, which is causing issues with head rotation.
And by the way, far too quickly, nurses, midwives, just everyone in the field jump to tongue tie on that. Why is this child not nursing easily? And they go and they want to cut the tongue, and then that didn't work. And they're like, well, we need to bring in a leche or someone like that. And oftentimes it's actually an upper cervical problem in the spine.
Yeah, absolutely. And how discouraging is that to moms? Like when they have tried everything, and probably dads too.
Come on.
But a mom who's trying to feed their baby and they've tried everything and they've gotten guidance and they've talked to the experts, and really it's just a simple misalignment of baby's atlas bone. Like that is so easily corrected.
Yeah. And it's interesting when we say things like it's so simple. And then in our world, it is simple because we know exactly how to, correct these types of things. But it's oftentimes the little things that turn into big things. It's, on a marathon, that rock in your shoe might seem like a little problem, but that rock in your shoe will fracture your foot if you pound on it all, for the next 26 miles.
Yeah.
So that little thing turns into a big thing when it's left there.
Yeah, absolutely. And using the marathon analogy, we're going the long haul, right? When patients come in and let's say they're 72, maybe they're okay with temporary relief. Maybe they're okay with palliative care. But the strategy of palliative care for a 2-year-old, that's not going to work. Because
a 2-year-old doesn't have sciatica.
No, it's not going to work because we're looking at the next 50, 60, 70 years of that child's life. Like, is a temporary fix going to work in the long term? Absolutely not.
Right. Right. And it's not like we're trying to interrupt pain cycles and cover up that symptom of because they don't have a symptom yet. They're not, that a child who has birth trauma. So we say birth trauma casually, but I don't think oftentimes moms and dads get this, is when you pull that child out by its head, right? And whether that's a manual or your vacuum extraction or, you have the forceps, you don't think about the amount of trauma to that child's head and spine.
Right.
But when you hold a baby for the very first time, like somebody just hands you a baby and it's this newborn, this fragile little, 9-pound baby. What are you so careful with? You're careful with the head and neck. You have the other hand, one under the bum and the other one like around the head and neck so that it doesn't flop its head around.
Right.
Yet birth is the one time in life we rip and grip on a child's head and it's like, well, it's done. Yeah. Beautiful, beautiful baby. Here's your baby boy. And we forget what just happened. Right. And that's in most ancient cultures, birth did not look like it looks now.
Yeah.
You weren't inducing labor with Pitocin and epidural, and the mom was actually feeling it. Mom's position was very different. Mom was either on all fours or mom was squatting and not in stirrups and not on her back. And, there wasn't this amount of force that was needed there because of the fact that the body was working with it.
Yeah. Birth, especially here in America, has become incredibly medicalized, and it's out of convenience. Really. It's out of convenience, and it is to the detriment of not just mom, but also baby.
Yeah. And not to get on this too much, but the convenience is actually what's driving this. And it is the fact that what's quicker and what's more efficient in a hospital setting, a planned, managed birth that the timing, maybe even that you can, take that mom back to the surgery center. That's why C-sections happen most frequently when there's a change in shift, when it comes to the doctor's shift, because the doctor is going to leave the shift. And so that's when the C-sections happen most frequently. There's a big research study on that. And it really comes down to managing something that was not meant to be managed outside of a crisis situation. And birth is not an emergency situation the way that it's the picture that's painted it to be here in America.
Yeah. Yeah. And I do think that it needs to be noted that medicine is fantastic for emergencies. Like, they are experts in what they do in treating effects. Right. But what we need to do is we need to get to the cause of a problem. When there are issues here, the difference is that within the medical system, the idea is what's happening, what are you currently experiencing, here's what we can give you to do something about that. Whereas as pediatric chiropractors, what we do is we ask, well, what's the cause of the problem? How can we support the body in doing what it's naturally supposed to do?
And respect the body. And that's the thing about what you're describing right there. It's not just, hey, let's get to the cause and let's fix the cause by any means necessary. No. It's, no, we're going to respect the body and work with the body to do what it's supposed to do and consider some of the intentions of what the body was actually trying to do in the first place.
Right.
I'm going to work with you here and not try to trick you, body, into doing what I think you should do and the timing that I think you should do it.
Yeah. And I think that this is a huge mindset shift for a lot of people, is that symptoms are actually good things. They are actually working in our favor. So what you're talking about is really just honoring our symptoms. They're our body's way of telling us what needs our attention and telling us that it's working. Really, every symptom that we experience is the nervous system and the immune system trying to keep us from dying.
Keeping us alive.
Yeah.
That's the whole intention of this whole thing called homeostasis, bringing you back to balance. You are in a extremely hot temperature room or environment. What do? You sweat. You bring your body back down to a set point, but you didn't do that. What happened? Your innate intelligence did. Within your body, there's this thing that I believe God put there that runs, governs, and controls you on a second-to-second basis and also heals you.
Yeah.
And it's interesting that you can actually tap into innate and read innate on some level with reflexes and things like this. And there's certain neurological signs and milestones, even with children, that you can kind of tap into, and with understanding, you can read these. And let's teach them some of these things, because this is important for kids, for parents and for ultimately children. What are some of these neurological signs and milestones?
Yes. I'm so excited that we're talking about kids today, because this is like where my whole entire heart lives. Kids develop in a predictable way. And there are certain milestones that I'm sure everyone knows. Pediatrician will say that they have to be doing tummy time, then they crawl, then they stand, and then they walk, and then they talk. The thing about it is that those are called milestones for a reason, and they are in that order for a reason. Earlier, you were talking about kids crawling. And some people think that it's so great that their kid just started walking, was on the floor and then pulled themselves up and started walking. They think that my kid is so advanced, they didn't even have to crawl. But really, crawling is a huge milestone because it's development for the brain.
You got to push that kid over. Kid starts walking before crawling, push him over.
Well, moms come in and they'll tell me that, and I tell them every time your child stands up, because they are not at a year yet. Encourage them every time they stand up, put them back on all fours, make them crawl longer.
Well, if they're skipping the crawling, so if a child is just like never crawled and just all of a sudden started,
right?
Because what happens is the aunts or uncles or grandma or grandpa or older brother and sister will take that child by the hands and kind of lift them up and start walking with them. And that, you don't want that. You actually don't want that yet. If that child's not, mastered crawling and crawling quickly, because even just biomechanically, the femur, the hips, they're just not ready for that. Neurologically, they're not necessarily ready for that. And that's why you don't do bouncers either. Before a child is ready before a child is walking, weight bearing, you're not putting him in one of those bouncer, I'm talking about, those bouncer seats.
Yeah.
You can hang it in like a doorway and all this stuff. And they've got advanced ones now, I get it. But that their body's just not ready for that. And I know it can be like a convenient way to go vacuum. The child is like stuck there. So
Get your chores done.
Right.
Yeah.
But neurologically, you don't want that, because you're going to cause potentially skipping of milestones and developmental delays and problems with even bowing of the legs can be problematic if that child is standing too soon and walking when that child's not ready for that.
Yeah. And that's what it looks like biomechanically, but it's a deeper issue, because that crawling pattern, that cross crawl, that activates neurological pathways, meaning strengthens right brain, left brain. And when a baby's born, they only use about 25% of their brain. Really, it's just their brainstem, which is the most primitive. It is the lowest level of brain power that you can have. A baby has to develop the other 75% of their brain during their life as they are growing into toddler age and then childhood age. Now, kids, when they get older and they learn how to read and take in information, that's how they develop the higher parts of the brain. But the vast majority of brain development happens within the first year or two of life. And the only way that kids get that input is through movement, through experiencing their environment, through sensation and feeling carpet and wood and earth. And so when kids are at that pivotal age, they have to be on the floor. They have to be. So when they skip over that milestone, that's not only causing biomechanical, causing physiological deficits, but it's also robbing their brain of the development that they need.
Yep. Creates all kinds of problems neurologically. And then we see these people, these patients, as they've gotten older and did skip those big time neurological development milestones. And what's really interesting, in school, I had a professor who teaches all about this. And he's like the guru on all of this dynamic neuromuscular stabilization and retraining that. And there's a lot of evidence that you almost have to go back and retrain those patterns, that cross crawl pattern. And it looks goofy. Like having you do a cross crawl movement for exercise and calling that exercise.
Yeah.
And like these older, 62-year-old men who are like crawling across the floor, learning how to like cross crawl and use their knuckles and not their digits and all these things. And, but it's incredible when you think about when you skip these steps early on in life. Now you're a 62-year-old man crawling around on the floor trying to get it back, and just think about how goofy that is. And it's just skipping these things, and maybe even a lack of knowledge from the parents.
Oh yeah, I had a class in chiropractic school that was completely dedicated to functional movement, and part of it was we did cross crawling across the gym floor. So think about that. Like I was 25 years old and I could not cross crawl. What in the world? So it felt super goofy. And after going to that class for a couple of weeks, finally got it down, retrained my brain, had those neurological pathways going. And then the next week we did it backwards. And it was like starting from scratch again. But I was also, it made sense because I was also a kid that didn't really crawl.
That'd be really funny to get a whole bunch of people and just like have a competition for cross crawling, and maybe we should get that one on video. That'd be excellent, wouldn't it?
Yeah.
But there's a lot of people who struggle, and then the issue is that all of a sudden now it's not just again biomechanically, but now you've got neurological problems, and that does show up in some of these childhood. Call them diseases or symptoms or whatever, but there are some common issues that kids are developing right now that they didn't necessarily develop at the rate that they are developing now. They didn't develop these issues 30 years ago. Think about autism right now, right? I mean, that is skyrocketed. And is that because of birth trauma? Well, birth trauma plays a role in all of that. It's an overwhelming of the nervous system, but there's a whole host of problems that's going to go into autism, like obviously toxicity. It plays a huge factor in that. But it's not just autism. You've got asthma, you've got allergies, you've got autoimmune conditions, ADHD. These things have skyrocketed in the past 30 years.
And the thing about it is that the brain can't tell you when it's injured, not like a muscle can. When you hurt, let's say you hurt your calf, your muscle hurts, right? When your brain is injured, it can't tell you I'm in pain, help me. The way that it does that is by mood changes, by cognitive dysfunction, by sleep disruption, by focus issues, by attention disorders. All of these things are your brain telling you that there's a problem, whether it's from skipping of milestones, whether it's from damage to the nervous system, misalignment in the spine that's affecting all of that. And what that looks like in kids is those childhood epidemics that you were talking about: asthma, allergies, ADD, ADHD, autism. These things are directly correlated to kids who are not developing at their specific rate, at reaching these milestones and making sure that they are doing exercises or having movement that will develop the right brain and the left brain equally.